Hi, welcome. It's Dr. Michael Turner here. I'm a physical medicine and rehabilitation specialist and look forward to talking with you today about core strength.
Okay, so when I think of core strength, I think of crunches, abs, all that stuff. So how would you specifically define it?
Well, you're on the right track,
Okay,
You're
good.
not entirely off. I would say from your belly button down to the underside of your glutes, okay? That's your core strength, front and back. So let's just define it that way.
Okay, so why is it important for us to establish core strength?
Yes, because it's the foundation of all movement. All movement begins with a strong foundation emanating from your core. So, for example, if I lift my arm right here, right, we're thinking and noticing immediately. Well, your shoulder's working, okay, but your shoulder blade's actually working, and your shoulder blade is attached to your spine, and so your spine has to anchor at some point. If my spine is not strong enough to do this, when I try to lift my arm, I'll actually tip and fall over, right? So everything anchors ultimately in that region.
Okay, so I know that there's also some other important muscles that we want to touch on: glutes, lower abs,
Yeah.
lats, transversus.
Yes.
Maybe you can go down the list there and explain why these are important muscle groups.
Exactly. As a rehabilitation specialist, I want to highlight certain muscles in particular that are important, right? So one of them is your lower abs in combination with your glutes. Okay. I'm going to maybe try to stand up here a little bit if I can stay
here,
on
here.
camera.
Yep,
Okay,
I
keep me
got
on
you.
camera here. Okay. So one problem that happens is as regards your posture down here, you develop what we call anterior pelvic tilt, and that's not a good thing. So anterior pelvic tilt kind of looks like sway back. So your back is kind of arched there, and your pelvis is kind of like tilted forward. So it's this concept. The opposite of anterior pelvic tilt is kind of straightening up, tightening your glutes, and like tightening up your low abs. You with me? We develop the anterior pelvic tilt a lot because people typically have weak and underdeveloped glutes and weak and underdeveloped low abs, and also some tightness in their hip flexors. And so it all kind of conspires to produce that problem. So strengthening up your glutes, strengthening up your low abs takes away that anterior pelvic tilt, gets you in a more erect position, which is more healthy for your spine and also for your hips. That's one concept. The other one is to talk about your lats. Those are very important, right? So your lats are gigantic muscles that swoop down from your shoulder blades and they actually dive in and attach on the back side of your pelvis. Okay? The typical exercise for lats would be pull-ups or a lat pull-down machine if you've seen that kind of thing, right? The concept here is that your lats tension up and provide support for this whole lower back area. Okay? Similarly, as your abs would provide tension for the front of your spine, your lats are the main player to provide tension and support for the rear part of your spine. And this needs to be balanced, right? The tendency is people want to start working on their core, they're going to do some crunches, their abs get overdeveloped, but their low back is not correspondingly strong, right? And your lats are one of the main important muscles, often neglected, that would help create stability and strength in your low back. Let me just give you an example. When you are bending and moving, let's say you're lifting something, right? Your spine is really flexible. It does not hold itself in a position other than if muscles were to come in and contract around it to hold it there, right? It's not a rod. It's more like a noodle, okay, a pool noodle or something like that. So when I tighten up my core by pulling in my abs, sucking in my belly button, right, strengthening up my glutes and all that, I'm essentially increasing the stability and support of my spine, sometimes up to a factor of 10x at that moment for stability, right? So my core strength as I go down stabilizes my spine to allow me to lift and move in a safe way rather than having a floppy noodle of a spine, which is prone to injury, okay? So that's glutes, that's low abs. We get our pelvis in good alignment. We strengthen up our lats to be just as strong as our abs here in the front and work in conjunction to stabilize the spine. The last concept I want to talk about is a little muscle that nobody's probably heard about unless you're really into the field, and that's called the transversus abdominis. That's a deep muscle in your abs, and it's actually circumferential. Think about it like a belt or like one of those metal clasps that you put around a beer barrel or something like that, right? So you've got that goes all the way around, and it's actually a muscle, and when it contracts, it just pulls inward like you're cinching a belt, and it relaxes, it goes out. Your transversus is the first and deepest and closest layer of stability around your spine itself. Therefore, extremely important in creating spinal stability. let's ask the question, how do you strengthen it, right? The prototypical way to strengthen your transversus is to suck in your belly button. That concept of sucking in your belly button, or like hollowing out your abs, by definition, that's your transversus clamping down and pulling in your belly button with it. So that's a very important core muscle. So another principle of engaging and strengthening your core is to try to exercise from a standing position, okay? So for example, let's say I were exercising my chest, right? I could be seated at the bench press machine, in which case my chest and shoulders are getting a decent workout, but my core is really doing nothing, right? This is stable, this is not being engaged at all. Or I could be standing, let's say at a machine with some cables, right? Gripping my cables. And now in order to do this, I have to first of all stabilize my core to even be able to move these cables, right? If I don't, I will fall over. So when you exercise from a standing machine, when you get up, when you leave, or standing position rather, when you get up and when you leave the machines behind, now you are necessitating that your core be more engaged, and it will itself strengthen, and you'll also be working in a coordinated fashion with whatever other muscles you're trying to use. That's a key concept. My second key concept would be minimize points of contact with the ground, okay? So for example, if I'm standing like this and I'm doing some biceps curls, I have 2 points of contact with the ground each foot, right? I mean, nothing complicated here. Let's just say I went onto 1 foot for balance, right? Just for kicks. Now all of a sudden, my core is much more engaged, right? My abs are working, I'm like trying not to fall over, and I'm trying to stay focused as I still do my bicep curls. Another example is like in a push-up position, okay? So if you can just imagine, let's say I'm in a push-up position, I would have 4 points of contact with the ground. Decent, but if I want more core engagement, how about I lift a hand up? Right? Now I only have 3. If I want more core engagement, I'll lift a hand and a foot up. Now I only have 2 points of contact with the ground, right? Now my body's likely to start to wobble, but that's a good thing. That's my core getting engaged, right? So if you're ever, on the ground, in particular doing mat work and such, or even from a standing position, if you try to minimize points of contact with the ground, you will necessarily engage your core much more. The last point I wanted to talk about is just the idea of coordination, right? It's not just core strength, it's coordination. Those different muscles need to be able to work in a coordinated fashion, right? So if we lift something, we don't want just that our abs are strong and our glutes are strong and our lats are strong, but those things all have to be able to be strong at the right time in a proportional degree, right? To keep our spine nice and stable, lest we get hurt or lest we topple over. So it's a concept of getting everything coordinated and fluid as well.